welcome everybody to the third webinar series of the School of Public Health Research Network on Health and Risk Communication. I'm pleased to welcome Dr. Marek Palace, who is a lecturer in the university in psychology, yep. University of John Moores University in Liverpool, and he's specialized in
visual
forensic and social psychology. Yes, I can let you introduce yourself, but I will say it briefly. You want to talk about today to us about visual arts in communication, and based on your experience in doing interesting work. Okay, so I'll leave you to you, and I'll mute myself. Thank you very much.
Thank you, Marco. Appreciate it. Right, folks. I personally believe in either listening or watching, so no slides for you. You'll have to watch me, okay? However, I appreciate you might get a little bit bored, so if you've got your smartphones with you, then please open them up, okay? We're gonna look up some images on smartphones, okay? So in essence, let me just tell you a little bit about my background. I started my PhD, like later completed, obviously, in social psychology. And for a while, I was looking for an area that would actually let me settle down in a little bit, okay? And the niche I found is applied psychology, which also relates to health psychology and health visual communication. And one of the areas that attracted me naturally is the issue of knife crime in the UK, okay? Now, if you guys open up your smartphones, and then in the Google search box, please type down knife crime poster, okay? And go on Google Images, okay? Right? And automatically, Google Image will bring up a number of posters, leaflets, images of various sorts. And can you see them on your smartphones? Yeah? So guys, based on the images on your smartphones, can you share your impressions in the chat box and type down, you know, the images that you've noticed, okay? What is it about, what are the contents of those messages? Can you try to type down your answers? Let's try to make it a little bit interactive, okay? So we've got images like carry a knife and lose your life. Yeah. Blood, very scary, danger, hurt. Yeah. Yeah. Blood, a lot of red, focus on saving life. Yeah. Fear-based. Okay. Yeah. Knives take lives. Yeah. Okay. What else can we notice, guys? Knives are bad. Okay. Right. There's one poster featuring growing up stages of a young man from the toddler to a younger kid, teenager, and then gravestone, right? With the caption, choose life, drop the knife. Okay. Now, the interesting thing is that those posters are still currently in use. Okay. However, most of them have not been subjected to empirical evaluation. Okay. And we know from research on teenagers that most of them do not fear losing life. Most of them do not fear ending up behind bars because firstly they know that you know, being minors, they will likely not end up in jail. And for some of them, getting a criminal record as a teenager would be a sign of toughness or, a badge of honor in their community, because that would, um, be associated with being, a tough guy. Yeah. And also let's look at um, the movies available on Netflix, right? Especially Hollywood productions. Most of them absolutely glamorize death, killing, stabbings, right? Um, and the portrayal of heroes is associated with being capable of being evil, right? Of being capable of hurting others. And one of the first funded projects I got was exactly on evaluating the posters currently in use. Okay. It turns out, folks, that those posters have not been subjected to empirical evaluation. Most of them actually do not seem to be working. So I've done interviews with teenagers, I've done survey research, and I've got teenagers who rated those images. Okay. And we had a pool of, I don't remember, 40 or so images about knife crime. Okay. And it turns out that those that are that were rated persuasive are actually associated with permanent injury or disfigurement rather than death. Okay, so in other words, younger people seem to be more afraid, for example, of losing the eye or getting their genitals mutilated than of dying. Okay, and we know statistically it's far more likely that you can get badly hurt or injured, perhaps end up with a permanent disability rather than dying immediately, right? And again, that's a message that resonates with younger people more, okay? And that's something that's not taken up by the media, okay? The police still rely on those images threatening young people with death or with jail, but very few focus on other consequences such as permanent injury. So we ran uh, a project in collaboration with a graphic artist and my colleague at Liverpool School of Art and Design, and we produced a few types of injuries related to stabbing. Right, so there was a guy image of a guy featuring a scar to the cheek, missing eye, and injury to the genitals and something else. And the ear, I think. There was a missing piece of ear. Okay. So which type of injury do you think was rated highest in terms of persuasiveness, in terms of potential risk? Can you type down your answers? Yeah, eye and genitals were seen as most appalling, if you will, right? Now, which type of injury you think was actually seen as attractive? Yeah, a scar on the cheek was seen as something that one could be proud of. Okay, I don't know. Maybe it's to do with the way films portray pirates and tough guys. A 3 centimeter or 2 centimeter scar on the cheek seems to be associated with something positive, with something that commands respect, okay? But missing eye or ear or nose, so there was another type of injury, missing nose, those images were seen as horrific. Um, and the theory, my personal explanation is like, it's harder for those guys, missing ears, missing eye or missing nose to find girlfriends, right? And no one's gonna respect them for that. Okay, so that's the main thing. And so the types of injuries are not emphasized enough. The other thing, guys, is that in terms of risk communication, we know that we have to focus on risk or visual risk presentation, but the risk cannot be too graphic. Okay, because you tell me, folks, what happens when you present people with a warning that seems too dramatic? What happens? Type down what you think. Yeah, fear may disengage some people. Why? Because, you know, it might be too scary to admit that it may happen to them, right? So we can see a similar thing when we look at cigarette packs, right? Most of them nowadays feature horrific images of, rotten teeth or badly rotten lungs, or missing um, pieces of flesh in the throat caused by smoking, right? And the injuries featuring in those images are so horrific that the impression I think most people get is that they are too graphic to admit that, they can happen to them. So yeah, um, that's something that we've got to consider, right? How to present risk the risk of injury or harm in a way that's graphic but not too graphic. And it's got to be tailored to the specific audience. Okay, it cannot be assumed like it is with current posters that I think that this is the way to go about it, and we're gonna be arrogant and threaten people with losing their lives or throw them the grave or show a teenager behind bars. It's just not working. Okay, so I think that we've got to involve um, maybe former perpetrators or individuals, affected or living in the community affected by knife crime, okay, or community affected by drug taking, okay. So we know that now, for example, vaping has been identified as a high risk activity, okay. Alcohol's been associated with health risks. But if you look at adverts, most of them associate alcohol with celebration, with partying, with friendship and celebration. And it's that culture of, persuading people that, consuming alcohol is a good thing. Okay. Um, and obviously it's not, because we know it damages the brain. It may make some people more relaxed for a while, but it can lead to other issues. Okay. Um, so when it comes to the involvement of art, um, again, that art has got to be pilot tested by a focus group to start with, and then scaled up um, in a quantitative measure, in a quantitative manner, if you will. Okay. So we don't have this culture of communicating risks on a level that is used in the corporate world, right? The corporate world uh, is much better at risk communication and persuasion than the world of health communication. So those guys who are in it for profit are better skilled at getting our money and persuading us to do certain things that are not good for us. So look at, for example, at insurance companies. Guys, when you look at adverts for life insurance policies, what images can you think of? Or maybe, please use your smartphones and let's just type down in Google image life insurance policy. Okay. And please type down the contents of images that show up when we type it down, life insurance policy. Or maybe, okay, so we've got Maybe that's not the best prompt. Maybe let's try maybe Aviva life insurance policy. Nothing wrong with Aviva, as an example. Or some other insurance company name, whatever insurance company name you know, just type it down. Or maybe let's try insurance, life insurance policy adverts. Insurance policy adverts. And yeah, I think that's better. Life insurance policy advert. Okay. Yeah, we can see families, we can see peaceful images, right? But guys, what is life insurance policy? It's preparation for death, essentially, right? So we don't have life insurance companies advertising coffins, right? It doesn't happen, right? Um, so we've got these images featuring families, featuring um, kids running on the beach or couples holding hands in the forest, people holding their heads high in looking towards the sky. Everyone's happy, right? So there's no association with death whatsoever. Okay. And in a way, this is artistic, but that's been pilot tested. Okay. It's not something that, unlike unlike public policy makers, the corporate guys seem to be better at communicating things. Okay. And that's something we can learn from them. Okay. So I've used a similar strategy to advertise bowel cancer screening on my recent funded project. Okay. If you guys maybe in the Google image, please type down bowel cancer screening. And again, please type down the contents of images that show up in Google Images. What can you see in there? Yeah, we can see clinical tests. Okay. Um, we can see the picture of a human bowel. I can see the picture of a toilet paper. Guys, off the top of your head, because I've run the rating of those images. Okay. The toilet paper. What rating do you think the toilet paper roll got? Very low rating it got. Yeah, very low. Um, Again, there was one image of a toilet bowl to advertise bowel cancer screening. Again, very low rating. Okay. We can see an idiotic picture of a human face with a wig in the form of a human bowel. Okay, ridiculous. So what we found, what our results showed was that bowel cancer screening images were seen as most appealing when they featured images of families, couples smiling and holding hands. So basically, almost the same theme that you could see in the life insurance policy adverts worked for our bowel cancer screening adverts. Okay. And that's something that the NHS is not using currently. Okay. I don't know why or who approves those images that are currently in use. Uh, but firstly, they have not been subjected to evaluation. They have not been maybe they've been subjected to some limited focus group testing, but we're not talking about a large scale of thousands of participants. So I've completed my first stage of well, not the first stage. We completed our grant on evaluating bowel cancer screening images, and now we've partnered with a producer of testing boxes, and they've agreed to actually place our images, some of which are AI generated, right, on the boxes. We're going to send them to thousands of people if the grant gets approved, and we're going to measure the actual return rates compared to the standard boxes. Now, guys, when you look at the um, bowel cancer screening test kit, what does it remind you of? Can you type down what it reminds you of? Pregnancy test. Okay. Guys, what is pregnancy test associated with? Are we always happy to run that pregnancy test? Yay, we're gonna have pregnancy, or not, maybe what else? Yeah, anxiety, exactly. Anxiety, disease, right? And remember, people as what do people associate cancer with? Please type down what people associate cancer with. Death, what else? Chemo, yeah, end of life, suffering, exactly. So negative things. Also, from the interviews we've run, we've found out that the bowel cancer testing kits remind people of COVID tests. Again, anxiety, uncertainty, and lack of trust as well. Okay. Um, so that's something that needs refinement because current, like guys, we're talking about public taxpayers' money, our money that the government takes from us, spending on those useless images. Some of them are useless, some of them are actually, um, working to the contrary. That they do more harm because they discourage people from getting tested, right? And that's waste of public funds, right? So another part of the project is that along with the images that we're going to place on the actual um, testing boxes, we're going to insert a comic strip. Okay, so there'll be participants receiving a comic strip featuring bowel cancer testing. Okay, uh, some of you may think, why the hell a comic strip? But what do people associate comic strips with, guys? Please type it down. What comic strip can you think of? What graphic novel can you think of off the top of your head? Marvel. Has anyone heard of Asterix? Yeah. So overall, comic strips, graphic novels are associated with positive things, with humor, right? So we want to explore the role of humor in reducing cancer testing anxiety. Okay. And so that's what we're going to test. Okay. Um, and how we go about it is we evaluate existing images in terms of rating. We do not use the word persuasive. Like we don't ask participants, how persuasive do you find this image? Thing is, when you ask people how persuasive is this or that, then that's a loaded question, and automatically they will say, very or not at all. It's more effective to ask about how appealing is it? Because if something is appealing, then it's memorable. That's what we want. It's emotionally charged, and it's likely persuasive, right? Also, on top of this, guys, apart from the rating, we used remote eye tracking. So we don't simply rely on what people tell us in their interviews. We don't just rely on what rating they give us on surveys, but we also have used a physiological measure using eye tracking. So basically, we use the remote software called Real Eye, and as long as our participants had access to a camera-enabled laptop, they could take part in the eye tracking study, and the Real Eye software captured their pupil dilation, the eye gazing pattern, gaze fixation, gaze duration. Okay, so measures associated with attractiveness. Okay, and then we pulled all those key elements together, those most persuasive ones, and we used AI generated software as well as a real life graphic artist at Liverpool School of Art to generate new images that enhance those already rated highest, right? So that's the approach we've used. Okay, and we can see that this approach to health risk communication has a lot of potential in other areas. Like together with my colleague and collaborator, Dr. Marco Bardus, we've just applied for a grant on promoting breast cancer screening. So hopefully that will get funded. That should definitely get funded because the current breast cancer screening images leave room for improvement. Okay. Guys, so in a nutshell, that's my story. I hope it wasn't too boring for you. And, to be honest, I didn't prepare very well for this presentation because I was busy with other things, but I hope it went okay. Any final questions from you guys? Because I'm finished now.
Thank you, Mark. I think it was very interesting. I like your approach and your interactivity. I have several questions actually. So you said a lot of things that made me think beyond our project and so on. But before I start with questions, I would like to see if there's anyone who wants to raise their hand and speak, or put a question in the chat, or a Q&A.
Yeah, whatever feels more comfortable, guys. Speak or type down.
Mm-hmm.
Sometimes if people
Samira?
have no
Samira,
questions.
Samira is
Hi,
one
yeah.
of our network members. Go on,
Hi.
Samira.
Can you hear me?
Yeah.
Yeah.
Yeah. All right, great. Thank you for the talk. It was very interesting. I'm just wondering, first I wanted to ask if you could like share some of the posters or like graphics you worked on. And I was wondering if you can talk more about like why the NHS and the government aren't like using health communication or risk communication research, and why they're still like producing posters that are not like evidence based,
Okay.
and what could we do to like
Okay.
change that?
Why don't they use empirically tested images? I don't know. I think they should be asked that question. I have no idea why not. I think they should be, but it's also our responsibility to promote empirically tested images and visual communication. And very few people specialize in visual health communication, and that's something that I've started working on very recently. So why they don't use it, I don't know, but I think we've got a responsibility as researchers and scientists to promote this sort of communication and make policymakers aware of the possibilities that we have. And also, we cannot simply assume that, you know, cartoon images promoting this or that are effective. Guys, if you go on the WHO website, the World Health Organization website, look at the images the WHO uses. Some of them look very simplistic, very primitive. And again, I don't think they've been subjected to evaluation. But interestingly, guys, I've got to tell you that when we ran our image rating on bowel cancer screening, we collected data from the UK, from white Brits, Indian Brits, and Indians in India. And surprisingly, the common theme was almost the same: families and couples smiling together, right? So there's something universal about the family bonds that can be taken advantage of when communicating risk. Now, when it comes to your question about the images, let me just access that. I've got a link for it in my CV. I'm gonna find it and paste it in the chat box, and you can access that yourself. So just give me 1 second.
Yeah, meanwhile, I see a comment or slash question from Claire. saying big organizations are risk averse and tend to go for safe options unless heavily evidence-based. I think I just wanted to tap into this and saying part of this network is probably the purpose of this network is to raise awareness about the necessity of evidence-based approaches to health and risk communication.
Yeah.
And I'm very pleased to have this webinar with you, Marek, today. The question that Claire makes is, what are the next steps? It would be good to have advice on toolkits for public health teams in the longer term. This could be part of an output, I would say, of a project you might put together. Why not? So not only reflecting on the guidance, but also evaluating, but also giving advice on what they should do.
Yeah.
The problem might be the process. So how long would a project like yours take?
We can finish that in 15, 18 months.
Okay.
When it comes
Yeah.
to behavioral, when it comes to intentions, it's always easier to implement. When it comes to behavioral changes, it's way harder. So when it comes to measuring the impact of our images on bowel cancer screening behaviors, we've got a very good measure of the rate of boxes that get returned compared to the same period last year. That's very easy, right? When it comes to other behaviors such as smoking, it's harder because we will have to trust people's opinions or control, how many cigarette packs they bought or smoked. That's way harder. So some behaviors are harder to measure than others.
Yeah.
But yeah, guys, I've pasted the link.
Yep, I see it.
Images
Thank
that
you.
we've generated. So you're welcome to copy and save that link if you wish. Yeah, but Marco, I'll be very open to a project like that with
No, I
you.
think
So
sky's the limit here. So there are plenty of opportunities, I think, to analyze existing communication materials across the
yeah,
UK. I think the
and also in
context
terms,
makes a difference, though. I just want to say the context makes a difference.
Yeah.
And so probably the reason might be that for WHO, for example, they might rely on existing collaborations with advertising agencies and creative departments that just say, we need imagery in this area, and so they just pay them for that.
Yeah, absolutely. But those imagery elements have not been subjected most of the time to evaluation. Guys, can I ask you, have you seen any posters advertising support for men with suicidal thoughts? Because I've seen quite a few. I've seen posters and billboards advertising prostate cancer screening with the caption, "Men are worth saving." Again, does that work? I don't know. I've just applied for a grant on prostate cancer screening using the approach I've described. We got rejected, but I think there's scope for.
Do you know rejected why? Do you know the reason why? No.
No, they just told me they didn't have enough money. But
okay.
So they want to, keep doing they're gonna. They said they wanted to use their. No, they didn't say that. I assume that they want to keep using their images because they already got them.
Yeah. I mean, they might rely on stock images, or they paid a subscription for those and just say, we need to use this because we already have paid for that. I'm not saying to justify the choices they made, but it might be various reasons.
It's our responsibility as researchers to show them that they need to be examined. So risk communicate. Yeah.
I wanted to just add one element here. You mentioned comic strips. I think it's an important aspect to consider storytelling to promote health communication messages. Let's say it's an interesting approach.
So same thing when it comes to STD testing. People may be anxious about getting tested for STD, sexually transmitted disease. People may be anxious about getting tested for HIV, right? But nowadays, even if you are tested, if you test positive for HIV, if you take a specific drug, and it doesn't even have to be on a daily basis, the viral load in your body can go so low that you can have normal sex with another person without any protection. You will not infect them because your viral load will be undetectable, basically, allowing people to live normal lives. And that's something that, again, should be promoted more. This sort of awareness that can be communicated through visual arts, right? Most people don't read, guys, right? When you look at the time people spend in their free time, most people watch films, Netflix, rather than read books. So visual communication trumps reading written communication, period. You know, and images resonate with people more than words or than, you know, written communication
Mm.
leaflets or statements by politicians or guys in suits.
Mhm. Yeah. So we are in the context of persuasion, right? Because I
Yeah,
think this reminds me of the elaboration likelihood model back in the
yeah,
80s, where
yes,
relevance of the message is given
yeah,
by what you see, basically.
yeah,
So the visual element plays a central role there to
yeah,
activate your peripheral route of persuasion, of decision making, let's say, according to the
yeah.
model. But it is an essential element. So I definitely agree with you, and I'm very pleased to have this discussion here. One thing that I wanted for you to elaborate on is about the process of doing focus groups and then following up with
Hmm.
quantitative
Yeah,
testing, evaluation, and so
yeah.
on. And I think this is a very sound and robust approach to this. One of the things that funders tend to be interested in now is how to minimize inequalities, especially the
Hmm.
NHR. It's interesting
Yeah.
how mass media, there was a call recently about mass media content increases inequalities in health inequalities when it talks about mass communication. So we are in the
Hmm.
context of that, I would
Yeah,
say. But what would be your take on how can we minimize inequalities
yeah.
in the way we produce messages, visual
Okay.
messages?
So firstly, I think it's worth involving representatives of the audience that you want to target. So basically, in our breast cancer screening project with Marco, we plan to use um, women who actually have been affected by breast cancer or their family members have been affected by breast cancer and ask them to help us co-produce new images. Okay, so that it's not like two white dudes, Marco and Marek, talking about the images that should persuade women to get tested for breast cancer. Okay, because it's got to be um, it's got to involve women and preferably patients. Okay, so that we want to target the representatives. When it comes to reducing inequalities, I think the visual approach is excellent because um, visual imagery trumps language, right? So we don't have to worry about someone's reading ability not being good enough or someone speaking a foreign language. Um, we can also incorporate elements of specific culture of the representative of the people that we want to target. Okay, so if we target, this and that ethnic minority, for example, because they tend to screen for this and that cancer less compared to white Brits, then it's worth incorporating elements of their culture within the imagery. And that could be, you know, a dish that they like to eat, or it could be, you know, an actor, a movie actor of their ethnicity, you know, who will be likely seen as a higher authority figure than a white dude, potentially. Okay. Um, so the visual approach by itself has the advantage of going beyond and transcending linguistic barriers because, small kids watch films and cartoons, right? And they are attracted to them naturally, right? Um, we can also use elements of popular culture that transcend ethnicity. So, for example, the preferences for football, right? So, if you've got a footballer who's respected, he will likely be seen as more persuasive than someone who's not. Like when you've got a footballer who, admits to having tested for HIV or tested for prostate cancer, that's associated with something positive rather than anxiety. Yeah? Or if someone even gets diagnosed with HIV or prostate cancer and admits to that, that reduces shame, and that's a positive thing in health communication. Obviously, we've got to be careful in terms of enabling participants to give them their data. So let's say that eye tracking approach requiring a laptop and a camera. Okay, we know that disadvantaged community members may not have a laptop enabled cameras, so they might have to be invited to the lab. Their travel expenses have to be covered. Maybe lunch should be covered, a voucher, but those things can be covered. So we've got to be mindful of the barriers, barriers to technology access. But those are things that can be managed quite easily. Yeah.
Thank you. Are there other questions? Otherwise, I have plenty, but I don't want to be the only one speaking here, because I have ideas also for the next steps.
My approach is like when the audience is silent, I
They
assume
are
that
thinking.
no, or I assume, well, I've got to stay on the positive side, so I try to think we probably ticked all the boxes, and we've left the audience speechless, which is a good thing. So.
Either thinking in awe. I was thinking about the next steps. I think what I've seen from my understanding and reading of the literature on health rights communication in Europe, let's say not only in the United States, we need some evidence, strong evidence, robust evidence of cost effectiveness of this approach, saying, you guys being the funders and the NHS organizations and so on, you keep on investing in doing communications, and that has a cost for you. But what if you did the approach that we're proposing here? So a more tailored, evidence-based, which has a cost, of course, in terms of production. But there's no evidence. We cannot demonstrate the superiority of this. Not yet. Not yet. That's my point. We cannot yet demonstrate the superiority of this approach in terms of cost effectiveness and cost efficiency. Because if you say, what if you started printing several messages of this kind for different segments of the population, which have been evaluated and positively rated by our method and so on. And this eventually will be cheaper with the economic of scales in printing now and digital communications. This might be cheaper than doing a mass media campaign that covers 90% of the population with the cost per contact might be 90 pence per person. But then eventually you're not reaching the right target. So it's inefficient. It reaches a large number of people, the mass media approach, okay? It reaches a large number of people, and so you can save money in reaching out everybody, but you're not reaching the right people. So it might not be efficient. You see what I mean?
Okay, but then, for example, if you've got communities, Britain is quite segregated when it comes to communities. We've got certain communities living together in certain cities, and if we know that this and that ethnicity is underrepresented when it comes to cancer screening, then I think it's quite efficient to, for example, place specific billboards aimed at that community to promote, for example, cancer screening uptake, right? So it doesn't have to be like media, TV production stuff, right? It can be simply a matter of replacing the currently used billboards and that are tailored to the communities that are underrepresented. Yeah, so I understand the point about efficiency. I think that's a good point, but then it doesn't have to be a crazy cost. It can be a matter of replacing the currently used billboards and tailoring them to the communities in specific areas. And that would involve the collaboration with the local authorities, the city council, for example.
Yeah, definitely, yes.
And I've also explored the topic of promoting the seeking of help by women fleeing domestic violence, right? Yeah. Okay, guys, any other questions?
There's a thank you from Sarah Simons. I got a lot of this, work in sexual health, and a lot of what was discussed completely makes sense regarding health communication. I have to jump to the next meeting. Thank you, Sarah, for attending. Hopefully, we'll see you in another webinar.
I have
Oh, Samira, yeah, go on.
Hi. I have another question. Just like a bit like off topic, but like I was wondering, you talk a lot about like AI images, and I'm wondering, like I feel like from like anecdotal evidence, I feel like older people are less likely to like be able to like distinguish between like what's AI and what's like a real photo. And I was wondering if there's any research, if there's like a difference in like effectiveness or persuasiveness of like AI images versus not AI
Right.
images.
Okay. I'm not aware of that. The purpose of our use of AI was to reduce the cost. Okay. So rather than working on actors and running photography sessions, it was easier to create new images without infringing any copyrights, because the images we've created feature people who do not exist. So, we don't have to pay those people. So that reduces the cost massively. And it's very quick as well. So let's say that, our survey, interview and eye tracking data show that, there are, for example, 7 elements that should be captured by the specific image targeting this and that community. You can type it down and those images can be generated quite quickly, oftentimes for free. So yeah, so I saw it more as a matter of reducing costs rather than
Yeah, then
telling what's
that
more
makes
effective.
sense.
Yeah.
But I feel like, just like for me personally, whenever I see like an AI image, I'm like, oh, that's like AI, so I think it's like fake.
Yes,
So I'm
yeah, I
thinking,
think you are right. I think you are right. If the AI image seems fake, then it undermines credibility and trust. I think that's a very good point that you've raised. Yeah. But based on the images that you've seen from that link I sent, I think they look quite realistic to me. I wouldn't
yeah,
say that
yeah,
they're,
I think they're quite
yeah.
good. You can still tell a little bit, but I'm just wondering if like
I think the issue
people,
of trust is absolutely,
yeah,
absolutely important. So yeah,
yeah, I was just wondering if there's like evidence in the literature of
I'm
like
I'm not
if
I'm not
there's like
I'm
a
not.
difference,
Maybe there
you
is.
know?
You'd have to look it up.
There
I
might
wouldn't
be
know.
Yeah.
there might be some evidence already.
Yeah.
Thing is that the technology also evolves quite quickly. So generative AI tools are getting better in
Yeah.
generating
Imagine
images also.
imagine them in 20 years.
Yeah, there will be question whether everything is generated by AI by then, and there would be no
Yeah.
problem about trust, because say, oh well, this is clearly
Yeah.
uh,
Yeah.
we're living
But
in the
but now,
post-truth reality
yeah.
anyway.
Yeah. But I think if people realize that an image is AI generated and promotes some health behavior,
Mm,
then it will take away the trust. It might be associated with something like lab-grown meat, for example,
mm,
right?
mm.
Something that's not trustworthy. So trust, credibility, and authority are elements that are absolutely vital to persuasion. And the images have to be relatable to the community. Larry, you want to say something?
Larry has a question. Go on.
Yeah, thank you so much. This is Larry from Zambia. I just wanted to make a contribution
Go on.
regarding AI images in enforcing messages. I work for the National Malaria Elimination Center in Zambia, which has a responsibility of actually focusing on the agenda to eliminate malaria in Zambia.
Right.
So
Right.
2 weeks ago, we're trying to formulate some key messages for malaria, and we needed some malaria champions to be part of the drama series that we're developing. And so some of the images that the experts we're working with produced were actually AI generated. And the bone of contention that rose was that as we are trying to enforce these messages to the public, we need to use real images so that they appreciate the message where it is coming from, and also the credibility to say even our political leaders, our traditional leaders are actually part and parcel of this movement. And so that also makes it easy for the local people who may not be so much vested with technology to actually appreciate the message and the credibility of the message that comes with it. So, of course, in the long run, as Marek was saying, that
Go on.
We lost you.
Larry, can you say that again?
The connection may not work well.
Let's give him a minute.
Yes.
Well, guys, in the meantime, I've typed down my email address. So if you're interested in, running any projects related to visual communication or a grant or whatever, you're welcome to email me. Larry, are you with us now, Larry?
I'm here. Are you able to hear me?
Yeah, now we can hear you.
Yeah, you broke up, but you can talk again. Guys, we have 5 minutes because I need to jump to another meeting in 5 minutes, literally. Larry, you were talking about those images.
Oh, sorry, I thought you heard me. I thought you heard the. Oh, okay. So I was saying we're generating key messages for malaria prevention, and we needed to have some images for malaria, what we call malaria champions, like those influential people in society, like politicians, traditional leaders, who have played a pivotal role in malaria elimination. And so there was a bone of contention because some of the images that were produced of leaders were actually AI generated. So my team had that particular argument to say we need to use real images of people that people can easily identify with the message. To say we know this is the president, we know this is the priest, or this is a pastor or a traditional leader, and is also championing this particular cause. So that carries more weight, unlike just sure.
Yeah, I got it. And I think if we can use real life images, then we should 100%. And it's just, we wanted to reduce the cost, but if there are funds and resources available to use real life images, absolutely. However, there's also possibility for the use of memes, right? Guys, when it comes to the COVID vaccine, for example, it's been associated with disinformation, with harming people, with conspiracies associated with depopulation, right? So on a different funded project I completed, we ran counter memes, and memes, guys, are related to visual communication and humor and art, right? So we tried to generate memes that counter conspiracy theories by undermining the arguments of conspiracy promoters, if you will. Okay. So there's a lot of scope for visual communication and art, memes, posters, AI generated images, cartoonish images, real life images. A real life photo can also be artistic, even if it's real life, doesn't have to be AI generated, right? The angle from which you take the photo, the composition of light, the background, those elements can be considered artistic without any artificial input.
Yeah.
Okay, guys, I've got to.
Yes, I want just to conclude. Thank you, Marek, for your participation. I want to leave you with a comment from Claire. She says that co-produced health-related messaging via art, using storytelling, theater, cartoons, etc., will have multiple other benefits contributing to the broader reduction in health inequalities. So the process is equally beneficial to the outcome. It would be very useful to demonstrate this clearly, and I think we can set up ideas here to demonstrate this, maybe to demonstrate also the cost effectiveness of this approach.
Yeah.
So thank you very much again. Thank you everybody for attending. I left links for the network and for the next series of webinars. Stay tuned and see you next time.
Yeah, guys, you can see my email if you want to run anything.
It's in the chat.
Anything. Yeah, lovely. Thank you for the invite, Marco. Guys,
You're more
appreciate
than
your
welcome.
attention. And I hope it wasn't too boring. Thank you, folks.
Absolutely not. Very interesting. Thank you, Marek.
My pleasure.
Bye,
Thank you.
everyone.
Bye-bye.